Ninamani. My name is Denise Karpany and I am a Ngarrindjeri, Narungga, Kaurna and Nundjamatjena woman, which is saltwater, freshwater and rock people. And I am the Strategic Project Officer for Aboriginal Health for the Central Adelaide Local Health Network, based here in the Aboriginal team at the Royal Adelaide.
Ninamani, and thank you for having me today to talk to you. We're talking about closing the care gap for Aboriginal people, Torres Strait Islander people, when it comes to radiation therapy for cancer. Just how big a problem is it for some Aboriginal people to get access to radiation therapy?
Oh, for some it can be a huge problem, especially if they're not a local, not residing in South Australia or even the metropolitan area. So it's a huge access issue with trying to get access to radiotherapy. A lot of people will have to leave their homes, their home communities and family, and sometimes it could be for lengthy periods. So it means them leaving, coming to South Australia, to Adelaide to have their treatment.
We're sitting right now in the Aboriginal and Torres Strait Islander unit at just before you go in the door to the Royal Adelaide Hospital. And you're doing things here to try and make sure Aboriginal people get radiation therapy and other cancer treatment when they need it. A couple of things you're doing here that you'd like to see all over Australia.
This unit was specifically set up for Aboriginal and Torres Strait Islander people, patients, family members. Not all hospitals have that. You'll get some in Northern Territory with Royal Darwin Hospital and Alice Springs Hospital. And we do have some in the metro areas, but in the country areas there's not an Aboriginal team there, and not even all the hospitals have, whether they're an Aboriginal health worker or a practitioner, an Aboriginal health practitioner, because having people employed in those roles, Aboriginal people, is the key.
Why? Why is it the key?
Well, because Aboriginal people can identify with each other. There isn't that mistrust that comes from non-Aboriginal people, but also Aboriginal people can explain the patient's illness and the treatment and whatever is happening with them in a simple, easy to understandable language that everybody talks instead of using the jargon. But it's also if somebody comes in, whether they're having radiotherapy or cancer treatment, sometimes they're by themselves, but now what Carlin has done is specifically employ an Aboriginal health practitioner for cancer services, and Carlin is the Central Adelaide Local Health Network, and you'll be talking to my colleague after my interview and she can give you more information on that. That's one of the key things that they've done, but like it's a huge area and they need more than one person in that position. So that's a huge thing.
Well, thank you.
That's okay, you're welcome. Is that it?
Yes.
Wherever we live, we deserve the best possible chance to survive cancer and get the treatment that we need.
Aboriginal people should be able to access radiation therapy if they need it.
Right now, there are Aboriginal and Torres Strait Islander cancer patients who are struggling to get the radiation therapy that they need.
In some parts of the world, it's impossible for most cancer patients to get radiation therapy. The Targeting Cancer campaign is supporting the work to close the care gap in radiation therapy at home and abroad.
To learn more and find out how you can help, please visit the Targeting Cancer website.
Hey you mob, if you want to help, go to the Targeting Cancer website.